the Frontline Worker Pay Working Group will come to order. It's Thursday, September 2nd. The first item on the agenda is approval of the minutes for August 31st. Senator Housley, do you move those minutes?
So moved, Mr. Chair.
Senator Housley moves approval of the minutes of August 31st. Any discussion to that motion? Seeing none, all those in favor, please say aye.
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 Opposed?
Aye.
The motion prevails and the minutes are approved from August 31st, 2021. So on the agenda today is continued discussion of proposals and criteria, and we do have 8 public testifiers who've signed up. This is the last scheduled hearing of the working group. I expect we will continue to have conversations about how to formulate a final package, and it would be my intention that when we have an agreement of some kind, maybe potentially before final language, but when we have an agreement, we would have a final hearing with a chance to present that agreement and take any last public testimony or get questions if that would work. And so in our last hearing, we discussed a proposal that I brought forward, and Senator Housley, you discussed kind of a concept, I guess. And I wonder if you have, if you're able to share any more specifics about what you're thinking in terms of a, I guess the phrase was 2 buckets. I don't know if that's the right words we want to use, but that's what I heard last time.
Thank you, Mr. Chair. And I think we have to be honest with the public and be real with what we're working with, because again, we have $250 million. That's it. And that's what we're tasked to do. I think we can agree on a lot of things. We, in our discussions, we truly believe that our long-term caregivers, well, that's actually in the language that we were given from the federal government, but the assisted living, the nurses, the nursing homes, law enforcement, healthcare providers, first responders, truly were frontline, where they had COVID patients for long durations of time, multiple contacts, increased risk. That's the group. What would be a meaningful dollar amount to give to a bonus pay to that group? Not saying that everybody else in the state wasn't frontline in what they did too, but these folks actually knew every single day that they were going to work, they were at risk. They knew. The other folks didn't know as much as these people knew when they had COVID patients coming in or there were outbreaks in their nursing homes. Those people actually knew. So that's something all of us and all of the testifiers and each of us on this committee can agree upon, that group really does need or deserves that bonus pay. And again, we only have 250 million. So how many people are there in the state in that bucket? But how many people are in that sector? And that's what we don't know. And what is the meaningful number? If we give, I know you guys threw out 1,500 and 1,500 again, when we went the $1.3 million essential workers amounts to $2 billion. And even if you use the criteria to dial that number back, I still don't know what that criteria was to get to a more reasonable, or to get to 250 million. But I think we all can agree on that sector really was at increased risk. And if, let's say there's, 300,000 of those three, I still don't know that number, how many are in that sector that I just said, but what's a meaningful amount to give to them? Is it 1,500? Is it 1,000? How much can we give them before we run out of the 250 million? So I think we have consensus on that. I think this group too has consensus on how that payment should be made through an application process. I think we've heard that through our committee members. The application process, apply what sector were you in, and then have the department approve that. And I think we've also had consensus on, we don't think this hero pay should be subject to Minnesota state income tax. So that's that's where we're at. I don't know if any other of the members want to speak to that, but that's, I think that's great, Representative or Mr. Chair, that we have consensus on that, at least, that we have that one sector that we all believe for sure deserves the hero pay, and what that amount is and how it should be paid out.
Muted. So for purpose of making sure that we kind of hear more from the Republican side, I hate to even put it in those terms here, but the Housley, Kiffmeyer, New Brindley side of things, I see that Representative New Brindley has her hand up, and then I'll go to Representative Frazier.
Thank you, Mr. Chair, and thank you, Senator Housley, for your comments. And I certainly agree, and I actually think it is good. I think that there were a lot of things that we agreed on. My concern and the reason that I agree with what Senator Housley said regarding a dollar amount. I'm really concerned with the perception of the public, and suggesting that we are giving a $1,500 payment when really even if we cut that 1.3 million bucket in half, we don't have anywhere close to enough money to give people a $1,500 payment. And so I'm really concerned about being disingenuous in what we are offering these workers. And I don't want Minnesotans to feel like, those dishonest politicians pulling a bait and switch on them. I'm really concerned about that. So I think we need to be really realistic about the $250 million that we have, and allocating that in a way to do our very best to make sure that what we tell Minnesotans we are going to give them is what we are actually able to give them. I'm just really concerned about proposing a higher dollar amount and not being able to fulfill that promise to folks. So again, I really appreciate the sort of consensus that we've come to. It sounds like we all are in favor of that meaningful dollar amount. You guys proposed $1,500. I think probably realistically, that's maybe $1,000 to be able to do like $1,000. Really, I think everyone understands the risk assumed by those nurses in those hospital settings, long-term care workers, first responders. So I think we're in a good place to move forward. Certainly, it sounds like everyone agrees that this money should not be taxed. We certainly don't want it to affect eligibility for other programs that folks may be eligible for now. We certainly don't want folks to be pushed over a threshold that then they are losing a benefit that they otherwise would have had. So I think for me, the sticking point really is making sure that we are able to deliver what we are promising Minnesotans here. And so I think that probably for me, just that $1,000 is probably a more realistic number. But obviously we'll be able to figure that out a little bit better as we hopefully can come to a better understanding of the number of people who would be receiving the benefit. Thank you, Mr. Chair.
Representative Frazier.
Thank you, Mr. Chair. Yeah, I am optimistic when I hear us discuss what we have come to some consensus and agreement on. And I do appreciate that consensus around those particular parameters and areas. But I do want to say what I struggle with is the submission of a position or argument that some of our workers were just not aware of the particular risk that they were in. I would submit that all of our essential workers and frontline workers that showed up every single day, they were aware that there was a risk. I mean, they were watching the news just like we were every single day. They saw the numbers going up. They had family members that were being impacted by this virus, family members that were being taken away, that have been taken away by this virus. So it's incredibly troubling to me when we submit an argument that some of these workers may not have been in the same amount of risk as other workers. And that takes nothing away from what our nurses, our long-term care folks, and direct patient folks have. Well, that's one thing I think we may need to define what it means to be direct services and direct care person. But I take nothing away from the nurses and the hospital workers that we've had a tremendous amount of conversation around. But I also just say it really concerns me, considering the testimony that we've heard from many of our frontline workers that are not in those areas, but were absolutely in harm's way and dealt with that very high risk every single day. And I just want to make sure we center that as we're having this conversation, just not to discount those individuals and experiences that they had, because we've heard the testimony to support those experiences and confirm those experiences. And we've also seen the data, the cluster data, to show what the outbreaks are, to also confirm that they were very much so in harm's way and at risk, as much as the other workers that we continue to kind of highlight, which deservedly deserve to be highlighted as well.
So I guess, Senator Housley, I'm curious, I'm not sure that we're quite at the level of consensus that you described, but I do think we're in spirit, we like a lot of the things you said. So I'm curious though about so are you suggesting that we narrow the field to those core industries or those certain sectors and provide $1,000 and then sort of leave it at that?
Thank you, Mr. Chair. I'm suggesting we have $250 million. So we're tasked at getting that out. If we got that out to equally to the 1.3 million that is in Representative Frazier's bill, I don't think that's a meaningful amount. So again, I don't also believe that increased risk is the same as fear. We knew and still know, and there's still double masking in our hospitals and our long-term care facilities. They knew then there was increased risk, and there were outbreaks, and still are. So yeah, I'm suggesting that is a sector from our nursing homes, first responders, healthcare, long-term caregivers, that there may be only enough money just for those folks.
Yeah, I'm concerned that we end up leaving out a lot of people who were indeed at risk. Even, we don't, regardless of what kind of fear or risk or whatever kind of standard we use, a lot of people who were at risk and had no choice but to report to work, and weren't allowed to quit because the work needed to be done, and unemployment is available for people who aren't, it's not available for people who voluntarily leave. So people were in a tough spot and they were taking risk, and there are a lot more people beyond that. So I hope we can continue to work to find a way to address the broader group of people who were in the same position. They might not have been taking care of a patient, but there were a whole lot of people who were in risky, dangerous environments, because when people join together, with COVID, that's where the risk of spread comes from. So anyway, I hope we can continue to find a way to broaden this to include them. And I'm cognizant of the $250 million that we have. I'm also cognizant of the fact that we have additional ARP funds and projections of billions of dollars coming into the state coffers for next year. And there is no reason why we couldn't do this again, which to me argues for a broader group, even if we have to have a smaller payment amount, because then we can repeat it next year with additional funds if we choose to do that. But anyway, that's a lot of editorial for me, but I hope we can keep working on finding a path forward. I don't see other members seeking recognition at this. Oh, Commissioner Doty.
Thank you, Mr. Chair. I just wanted to, I appreciate the discussion thus far in terms of trying to assess kind of where we are and kind of the points that we do have agreement on. One of the things that I think is really important also to make sure that's included in this discussion is the cost of administration. There will be administrative costs that will be borne to put this out if we try to put together an application process, which sounds like we are pretty much in agreement that makes some sense. So there's a development cost, there's a programming cost for that. And then there's going to be some kind of interaction that's going to need to happen with the workers as they have questions and things of that nature. So I do think that there are admin costs, and in no way do we believe that those admin costs should be taken out of the 250 million. We want every penny of that 250 million to go to frontline workers. We think that's critical, but we also think that as the legislation is drafted, there needs to be monies from some other pot, if you will, that can cover those administrative costs. I don't think that the agencies involved will be able to bore those costs just because. So that's the point. I just want to make sure that that is out there and I raise that. Thank you.
Thank you, Commissioner. Senator Kiffmeyer.
Thank you, Mr. Chair. I always have to, when you call on me, I had to quick go get over to get myself unmuted. I appreciate it. Also, I try and put my hand down right away so I don't forget. I appreciate the discussion right now. One of the things I think that is just really important to consider, if we are looking at this group's charge and responsibility, then I think the consensus is quite clear with the $250 million that we have to also, as we've discussed before, in that meaningful amount. Beyond that, I think that's more of the legislature that can kind of go in that direction. But this almost sounds like something very, very different when I hear you talk, Representative Winkler, almost very different from the Frontline worker group. It seems to me that I'm hearing something a little bit beyond that. But if we're going to look at those who were fearful or being in that category, we'd probably be looking closer to 2.5 million people. And I don't even know if we stop there, you might just say all Minnesotans kind of a thing. But that's not the charge of this $250 million. It's the charges Frontline and some specific rules and goals that I think that we have. And I think there was consensus in regards to what Senator Housley has talked about here, and even all of us as well. I don't think there was any disagreement in regards to them, the frontline work nurses, those kinds of folks who knew of this and were in it to a sustained face-to-face, could not do anything but kind of work that they did. It's just really something above us right now. And so I just really think that we got to be really careful about staying focused with the charge of this particular work group. We're not going to solve all of these. It's always easy when you have a committee meeting, you want to do that. But I think we have a defined limit here as well. I think it's going to be important for us to, even within that, it'll be a challenge to do that. I think to come out of this work group with where we do agree is by far more important than to say we couldn't agree on anything. And I think there is plenty of agreement here. I would say too, Commissioner Doty, yes, we don't want to take it out of those administrative expenses out of the 250 million. But even there, that is something that, again, we are locked into the 250 million. We could say there's consensus to not do that, but where it comes from, how it does it, the amount and so on is still for, I think, special session to fill in that gap. Thank you, Mr. Chair.
Thank you, Senator Kiffmeyer. Senator Murphy.
Thanks, Mr. Chair. I have found the work of this working group refreshing in that we are actually doing some of the negotiation, or really all of the negotiation, right here in a public forum. And I appreciate that. When we left the last meeting, one of the things I believe we agreed to was we weren't going to exclude anybody. And now maybe we're moving away from that. That's okay. We can keep talking about it. And I think we should, because for me, that's a core principle. When I think about the purpose of our work and the mission that we were given, the issue of fear or responding to people's fear is not a part of our charge. I remember in the early phases of the pandemic when the nurses were working without adequate PPE, in part because the CDC relaxed the standards in an abominable way. There was a press conference where nurses were talking about what they were experiencing. And I recall somebody being asked the question, what can we do to make sure that people who are working in healthcare settings have adequate PPE? Isn't that a risk? And the response was, I think they're just worried. That's still under my skin. It really is. And so when we talk about people going to work in fear, it triggers that for me again. And I think we need to recognize that lots of frontline workers, regardless of the pandemic, work in situations where they bear risk. Mary Kiffmeyer, Senator Kiffmeyer, and I would both know about the things that people face in hospitals, whether it is bloodborne pathogens or infections, the physical risk of caring for people with severe mental illness and physical assault that happens. That is a part of the work of people who work in healthcare. It is also the case that others in frontline work work in situations and with materials and equipment that can be dangerous, and they know that, and they go to work anyhow. So I do really want to object to raising the specter of fear as something that should be a subject of our discussion, because I just don't think it's relevant here. And while many frontline workers go to work and face a level of risk and to their safety, what is universal about what we're facing right now is that we said, the state said, we need a segment of our workforce to go to work. Everybody else is going to go stay home, but a segment of our workforce is going to go to work in person. And we don't really know a lot about where this virus is, but you're going to go to work anyhow. And they did it because we asked and because we said so, and they did it fearlessly. And so I struggle a lot with the idea that we would say there are workers that qualify for frontline worker pay, and because we have said we only have $250 million and we want to make a meaningful contribution, that there are other frontline workers that are just excluded. I think that violates a basic principle of what Minnesotans faced and what they did for us. So I just want to be really, really clear as we are negotiating here in public, that the idea that we would exclude frontline workers, I just think is beneath us and doesn't reflect what I believe is Minnesotan support for frontline workers. And so while I understand we only have $250 million, at least for now, to this working group and in this charge, I don't want to exclude frontline workers who, by definition, had to go into work. So I think that is important. I think we're continuing to hear that from the frontline workers themselves, including, again, the president of the nurses, who made that very clear. We should include everyone, not just the nurses. So I know I said this stuff last week, or it's just 2 days ago. I'm bringing it up again. Because it is, I think, central and critical to this work, and I don't want it to get left behind as we negotiate here in public. Thank you.
Commissioner Grove.
Thank you, Mr. Chair. just wanted to echo some of the comments here. This has been a tremendous experience in just seeing how our workers are sacrificed across the state in so many different professions, in so many different sectors. And I think Senator Murphy is right that there is just a whole host of industries and professionals that we have heard from who had very real risks heading into their work. And we want to, of course, make sure they receive some meaningful recognition of that through payments from this fund. One of the things that I think is interesting about the application process from an administrative standpoint is, of course, just by the nature of having people apply for these funds, you get a degree of attrition. And when you get that degree of attrition, you then have that ability to look at a somewhat sliding scale, not for different money for different workers. I think we should have one payment amount, but it could shift, that amount could shift based on what comes in through the front door. So I think that's an interesting concept that Representative Winkler put forward, and one that we should continue to consider. And then it's just a small administrative point to Senator Kiffmeyer's comments of a moment ago on the admin fee. There's great precedent for getting additional money to pay admin fees to run programs. We did this during the pandemic for a $60 million small business relief grant fund that we ran via CARES Act funding, where we went back to the legislature and got an additional $2.5 million in admin fees to pay those admin fees to make sure we get this right. That money is critical, as Commissioner Doty laid out well, not only to run a great program, but to prevent fraud, which we want to make sure we do so that the right people are getting the money here based on the decisions of the commission. So I think we can work with that component of this to land it well. But just want to echo the comments here that we think we can get to a solution on this, and that we can include a lot of people with this money, and we shouldn't shut the door on potential future dollars as well. So thanks.
Thank you, Commissioner. So Senator Housley, setting aside just for a moment exactly who and exactly how much, you recited a number of other things that you think that we agree on, and I think I just wanted to restate them because I think that we do agree on those elements, and it'd be nice to check some things off. So you talked about an application process, which direct from employees, which I think we agree on. You talked about, and I think Representative New Brindley added, we don't want it to be subject to state taxes, which we can control, and to the extent we can avoid federal taxes, we want to do that. We don't want to disqualify people from other public programs that, again, where we can control it in Minnesota law when we pass this. And was there another one or two items?
Yes, Mr. Chair. The not subject to state income tax and the admin costs shouldn't come out of the 250. Yes,
that's right. So I don't know that we need to have any kind of motion or anything like that on that, but I generally think that we all agree on those provisions. And to me, that is some things that we can kind of check off and then move on to further conversations. We're just, we're kind of in a position of debating how broad versus how deep the pool should be, or some approach of narrowing it further through criteria and using data to get estimates, better estimates of it. I guess I'm curious about your position, though, on the question of not knowing for sure how much money we are going to, how many applications we will actually get, because these are going to be estimates, how we deal with the fact that we won't know and we want to maximize use of the funds.
Right. We don't know how many people. We've got estimates back that there's 200,000 in that group, in those sectors, 300 and up to 400,000. So, I mean, maybe the application, it's a first come, first serve. We put a deadline, November 15th, or a deadline on the application process, and those that apply, that's when it's gone, it's gone. But I think actually we could get that number pretty close. I think we could figure out how many there are in each of those sectors, and then divide that out by the number of dollars that we do have. That I think would probably be the best way to do it. How many people are actually in all of those different occupations?
Well, the reason I ask that in part is one of the questions that we have had is how many people in those sectors had to report to work and could not work from home. And I think we've had trouble identifying estimates for that. So your assertion that we could get close, I'd be curious about Commissioner Grove, who I just spoke and knows a lot about this sector data. I'd be curious about kind of your confidence level that we could get close to that.
Thank you, Mr. Chair. And when you say get close to that, do you mean an estimate?
An estimate of how many people had to report in person and were in various sectors.
Yeah, well, so we could do a couple of things. We could, of course, take a look at that overall number. And then we have those two indices that we've discussed here before. One is the BLS's index on the number of people that had to work in person in a given industry. And the other is the BLS's index on occupations within industry. Now, those are both national indices, so they aren't specific to states. So we can apply those percentages to sectors to get as close as we possibly can to numbers. But in terms of our confidence of that, I mean, I'd say give or take 10% maybe in terms of how close we thought we would get there. And then, of course, the application component, as you mentioned, Mr. Chair, has an element here in terms of how many would actually come in and apply. So that's kind of the X factor. But again, they're estimates, and so they can help us guide, and they should. But it's impossible to know for sure how accurate they would be.
Senator Housley, so what about the concept of having the final dollar amount being subject to the total number of applications?
Mr. Chair, I think that makes sense if they're in those sectors that we've got consensus on. And I think too, it's important that we make sure that they, were not able to work from home, that's in our criteria. And I think that's probably another thing we have consensus on, the ability to not work from home and maybe not collecting unemployment insurance also. Or collecting unemployment. And I think we have to, what is a meaningful payment? That too, I think maybe this group could hammer out.
And Senator Housley, I'm conscious of our need to make a decision. I'm also conscious of the fact that, even $250 means something very different to me than it does to somebody who's making $13 an hour. And so, that's versus other people in a sector who might be making more. So I think that's a really hard question. And one where we have, at some level, we have to acknowledge that we're not going to be tailoring to individual circumstances. We're going to be dealing with, at some point, a statement that we value you and that the value is in some way related to the dollar amount in this check, which is a pretty terrible way to do it. But I hope that I also know that most of those workers can put that money to very good use.
And Mr. Chair, to that point, and we don't have to decide that today. I think we do have some time before our special session, so we can leave that for a later date and we can get those numbers.
Representative Frazier.
I just wanted to circle back. I felt like at the last meeting on Tuesday that the members, at least the elected officials here, were very clear that we were not going to have a direct conversation about excluding workers, especially workers that were exposed to the risk and were required to come back to work. And I do feel like that this conversation is right back to where we were on that Tuesday when I raised the notion that we were having a conversation around excluding workers. So I just want to be clear if is that where we are right now? Again, for those that are watching, and this goes back to what Senator Murphy said, I appreciate that we're having this conversation in public because I think it's important for the public to see how we're deliberating about this and how we come to some type of conclusion on how things are going to go once we have legislation in place that will pass at some point, which I think we'll get there. But I just want to if we can clear that up for the public, are we back there on this conversation of exclusion, or are we still very much so at a point where we're trying to find the best ways as possible of how to include as many of our workers as possible?
Representative Frazier, were you directing that at any member in particular, or?
If any of our members, particularly elected, want to chime in on that, I'd love to. I think I'm pretty clear about where I am, and I think some others have too. But anyone like to chime in on that, please.
Well, I'm not seeing volunteers.
Mr. Chair, I'd say then should I be hopeful that I take that silence to mean that all of my elected colleagues on here are saying that we are going to be working as hard as we can to ensure and make sure that we cover as many of our essential workers as possible.
I hope so, Representative Frazier. Commissioner Doty.
Thanks, Mr. Chair. Also another point of clarification that I just wanted to ask about is, do we have agreement on the idea of some kind of income threshold at all as well? Particularly as we start looking at that healthcare sector. I mean, there's some pretty wide-ranging differentiation in terms of salary in that sector alone. So I just want to make sure that is that on the table or off the table, or kind of where are we with that?
Well, Commissioner, when we brought forth criteria on Tuesday, what I had said is that we would have an $87,000 cap, which I think comes from the federal rule or the federal language, but that perhaps we could make an exception for nurses or others who do direct patient care who may have higher incomes and have particular exposure. So that was what I had thrown out there. I don't know if we didn't really discuss that any further. So I'd be curious what Senator Housley would think about that.
Thank you, Mr. Chair. We haven't really discussed any thresholds. Again, I think we go back to where we have consensus in this group. We haven't, right, do you exclude nurses because, and by the way, we don't want to exclude, that's not what we're saying. We're trying to focus on where we have consensus in this working group. But we really haven't discussed a threshold.
Okay. Senator Murphy.
Thank you, Mr. Chair and members. And again, it is good to be having this discussion in public. I have heard reference now from the Vice Chair and from others about where we have consensus. And that is, I think, unclear to me at this point. I thought we left the last meeting with consensus about broad inclusion, that we weren't going to exclude anyone. And it feels unclear to me now if that is still where we are agreeing and where there is consensus. And so I guess I would ask Senator Housley or others if for me you could clarify what you see as consensus in the group. And we have done some good work here describing the things that we've already agreed to. That's good. And if that's what you're referring to, I understand. If there's something more than that, then I would really love the clarification. Thanks.
Senator Housley.
Thank you, Mr. Chair. Yeah, and thank you, Senator Murphy. I think this is, again, 250 million is what we have. And I think you are asking me what we have consensus on, to be clear. And I think what I've heard from the committee members here is that we all agree that long-term care workers, assisted living, nurses, nursing homes, law enforcement, healthcare providers, first responders, all were at increased risk. We all have consensus that group of people, that sector, were at increased risk during this whole pandemic and are worthy of a hero pay. We also have consensus that the payment process, the application process, that this money shouldn't be taxed by the state of Minnesota, and that it should, what was the other one? Now I'm asking you here, an admin cost shouldn't come out of the 250. So that I think we have consensus on, and Representative or Mr. Chair, I think we can have that discussion about the income threshold and not excluding nurses. We could have that discussion going forward also. But that, Senator Murphy, is what this group has consensus on. And if that's not true, then just let us know.
Senator Murphy.
Thank you, Mr. Chair, and thank you, Senator Housley. And this really is the heart of the matter. So you named a number of professions or sectors, some that we haven't talked that much about before, and some that we've talked about in great detail. And as I have talked about before, it is hard for me to look at the frontline workers and the conditions under which they worked and say the increased risk was borne by this segment. And I hear the argument about nurses and nursing assistants going into work every day, knowing they were facing people who were infected. But I think I can make with a straight face for the people of Minnesota, and I'm guessing that they would agree, that other frontline workers faced exactly the same conditions. They may not have known that they were talking with someone who was infected. They may have known, like that transit driver who knew that someone was infected was coming onto the bus, or the conditions of people who worked in meatpacking plants who, because of the proximity to one another, the lack of PPE, the speed at which with which they worked, that they were also at increased risk. So I respectfully want to say that if we're in your thinking, there's consensus around the list that you just named, I have to dissent and at this point say that group by itself is not broad enough from my perspective if the measure that we're looking at is increased risk, because I can make that argument very, very clearly for others that are not on that list. So I think we still have work to do to get to the consensus that is necessary for us. And I am deeply committed to that work because I want to make sure, just like you do, that we finish this job and that we move this money out of the treasury where it's parked and into the hands of Minnesotans who deserve it.
Representative Frazier.
Yeah, thank you, Mr. Chair. Thank you, Senator Murphy, for that question. And Senator Housley, thank you for that list. I think that answers my question that I asked a little bit ago about. We are back to this conversation about exclusion. That list clearly excluded a bunch of workers. And similar to what Senator Murphy said, there's no consensus if there is this conversation of exclusion, and we're being very explicit. If that is the list, that is an explicit exclusion of a large swath of workers that showed up every single day and put their lives at risk and put their families' lives at risk, their kids' lives at risk, due to the job of an essential worker. Because the state, we said, you need to show up to work to help all of us stay safe. You need to show up to work and do your job. And they did that. We didn't see an exodus of people quitting. We saw people showing up to work every single day. And so I will say that there is, I don't have a general agreement if we have a list that is going to exclude so many workers that did their jobs because we asked them to. They did.
Okay. Senator Kiffmeyer.
Thank you, Mr. Chair. I am just in this situation of hearing kind of this conversation and thinking of an ICU nurse being put in the same category as someone else who was in a job which we consider valuable, but saying that that's the same as an ICU nurse, I have a difficult time making that equation. And I think that's very concerning. But it seems to be also that there's a desire here to imply that there is, or stated so, that we can go ahead and do a big list for this 250 million, irrespective of the small size of any check, if any, on kind of a almost like a promise. Well, don't worry about it though, because we're going to go get more money from somewhere else. So we can just go ahead and do a big list. I don't find that very fair or straightforward with folks. I think being genuine about where we are and what we are doing. We all knew when we came on this Frontline work group that the federal rules and the state and so on, even mentioning those things, I think were very clear. So I just tend to really want to say that staying with the parameters of what we have, yes, but we knew that going in. 250 million is 250 million, a lot of money, but I think that implying somehow, don't worry about it, because we'll just do this and then we'll go after some other bigger bucket somewhere sometime. I don't find that to be something that I'm very comfortable with suggesting to Minnesotans in this situation. Thank you, Mr. Chair.
Well, thank you, Senator Kiffmeyer and Representative Frazier. I do think you've outlined some of the challenges and tensions here pretty clearly. And I do want to say, Senator Kiffmeyer, our proposal was to show that it would be up to a certain dollar amount, knowing that it would be less based on the number of applications, but not knowing how many would be coming in, and making therefore a statement that a future legislature or the future legislature in the future should consider doing the rest. And there was no attempt to be unclear or dishonest, but to say simply that we have an uncertainty about the number of applicants and therefore an uncertainty about the amount of money. So Representative Frazier, I'm going to let you go, and then I think we'll get to public testimony. I'm afraid we're otherwise not going to be making a lot of progress here amongst ourselves.
Thank you, Mr. Chair. I'll be quick. I just thank you, Senator Kiffmeyer, for your point. I appreciate that. I do want to call us back to, there was testimony that we had where Mary Turner, who is an ICU nurse, did say that she thought that other workers that were not ICU nurses should be included and should not be left out. So an ICU nurse made that statement. I just wanted to remind us of that testimony. And just one more point, and just in terms of the financial, the numbers, this 250 million is less than what we gave businesses and forgave for the PPP loans that went out. So I just want to think about that. We're giving less to our workers that made those businesses go during the pandemic. And I think we should consider that as we consider what more we can do and not be constrained by the 250.
Okay, thank you, Representative Frazier. Let's move on to public testimony. We have 8 testifiers. The first 3 are Louis McNutt, followed by Brittany Westerman and Sarah Holmgren. Mr. McNutt, if you are prepared to testify, please state your name for the record and proceed.
Hello, my name is Louis McNutt.
Please go ahead.
I'm an essential worker of MnDOT. I'm a member of AFSCME Council 5 and president of AFSCME Local 221. I'm here before you to talk of the time cost my co-workers and I have bared due to this pandemic. As a frontline MnDOT employees, there is no part of our job that can be done from home. We have continued to go into the work since the start of this pandemic. We, like everyone here, are more than essential workers. We are parents, spouses, siblings, and someone's children, any and all of whom find us essential. When this pandemic touches their lives, with shutdowns, quarantines, or COVID itself, sorry. When it taxes our time. To put this another way, When our child's school shuts down, we cannot come in. When our spouse is quarantined, we cannot come in. When our siblings have a medical emergency and need our help, we cannot come in. When we test positive for COVID, we cannot come in or continue to help our parents. When we cannot come in, we do not have the luxury to work from home to earn our paycheck. These are not what ifs. These are abbreviated examples for why we have no more sick, vacation, or personal time left. Now, I'm here giving my time because we are looking at several more months of essential frontline workers being needed. So many of my coworkers have been stretched to a breaking point. We have little reserve left. So many are on the verge of leaving. Some already have. We're asking for our work in the past and moving forward to be recognized for what it is, essential. Thank you.
Thank you, Mr. McNutt. Brittany Westerman, followed by Sarah Holmgren.
Hi, this is Brittany Westerman. Thank you for having me.
Please go ahead.
I am a med-surg nurse at Alamere Health in Alexandria. Working as a nurse in a rural area, I can tell you the COVID pandemic has tested our resolve as nurses in more ways than I can explain in this short time, but I'll try. As an independent hospital, we don't have the same resources as metro hospital area hospitals do. We don't have procedure teams. We don't have IV teams. We as nurses administer medications. We start our own IVs, review every lab, educate patients and families. During visitor restrictions, we are the support person for our patients. When COVID hit, there was a shortage of PPE, and we restricted access to our COVID rooms. And it was nurses that remained at the bedside day after day, hour after hour, doing the duties that physical therapy, housekeeping, storeroom, and care attendants would normally be doing because we had to save that PPE. We weren't just talking to these patients, we were touching them, we were moving them, we did CPR on them. We did so knowing we had to reuse our PPE, and we did so knowing that any slip in that technique could bring this terrifying virus home to our children and to our families. Being a nurse in a rural area also adds to the strain. Alamere Health specifically covers a huge geographical area, over 150 zip codes. Rural areas already have less access to health care, and the pandemic made our patients afraid to seek health care. So now, a year later, the strain continues, because now we're not only caring for COVID patients, but our normal patient population comes to us sicker and more progressed in their disease states. Our hospitals are flooded with patients, forcing us to keep acutely ill patients requiring a higher level of care longer, putting a strain on our doctors and nurses to keep them stable until we can get them the care that they so desperately need. Also, our rehab centers and our skilled nursing centers are also completely overrun. We're often having to delay our patients' discharge and keep them in the hospital longer because they simply cannot care for any more patients, or they don't have bed space. Despite all of this, we continue to administer monoclonal antibody infusions on top of our normal patient assignments, because we know how effective they are in treating COVID to keep patients out of the hospital. We nurses are exhausted. We're called 5 to 10 times at least a day, asking to come in and work more and give more. I hear more and more often from my fellow nurses that they've lost their passion for healthcare. They lost their ability to empathize and worry that they're taking this constant pressure and stress home to their families. The nursing profession has been regarded as one of the most respected and trustworthy professions for years. And this money can show us that you can care for us the way that we've stepped up and cared for you. And, you know, in terms of risk, we didn't wonder if we were encountering people with COVID. We knew it. And we weren't just talking to them. We were interacting with them intimately, you know, we knew the risk that we were taking, and we still continue to deliver it every day. Thank you.
Thank you, Ms. Westerman. Sarah Holmgren, followed by Lisa Archer and April Grunhout. Ms. Holmgren? We may have to, we'll move ahead and come back to Sarah Holmgren if we get if she's available. So Lisa Archer, followed by April Grunhout. Ms. Archer, are you available? There you go. Okay.
I am. So good afternoon. My name is Lisa Archer, and I'm a registered nurse and director of patient care at United Hospital Mother Baby Center in St. Paul. And I'm here today to testify on behalf of Allina Health in support of allocating funds to frontline healthcare workers. In my role, I see the interactions daily with patients, and I'm so proud and grateful for our team, our entire team, multidisciplinary team, and the care that we provide. You know, over the last 18 months, I can't tell you how many opportunities I've seen where all of our healthcare workers, no matter the role that they're in, whether they're environmental services workers, cleaning our rooms, you know, all the way up to those that are providing care at the bedside, it takes every single one of them working at their best and showing up and really having the heart to care for our patients. It takes all of them every day to get the job done and really make everyone, including our COVID patients, feel safe and secure and well cared for. And it is a challenge, and it is wearing on them. So we are committed to supporting our employees and have implemented numerous, I can think of 15 plus benefits in the last 18 months that we put in place to support them, including a 14-day paid COVID leave policy through March of 2021. We launched a new well-being program with $100 placed in their well-being accounts to be used for well-being expenses to help them try to take care of themselves. We've added new anxiety, sleep, and financial support systems for them, as well as premium holiday and medical and dental coverage for the months of December that the organizations have paid for, in recognition of their sacrifices that all of our employees made in 2020. So we continue, I don't think anybody anticipated we would be continuing, but we continue to face the challenges of COVID-19, and the role of the frontline healthcare workers remains critical to saving lives. Whether it's the lab tech processing the results, the environmental staff, as I said, cleaning the rooms, the teams providing direct care to a patient, we absolutely support the state recognizing the care team for their continuous hard work. As you deliberate how to distribute funding for the frontline workers, I urge you to keep healthcare workers at the forefront, and not only those that are providing direct care at the bedside, but the support workers as well, as a way to show gratitude for the work already done and the work that they will continue to and are continuing to do. Thank you.
Next, we have April Grunhout, followed by Arlen Swanson and Nathan Johnson. So, Ms. Grunhout, go ahead.
Thank you, Mr. Chairperson. April Grunhout. I am the Chief Nursing Officer at Riverview Health in Crookston, Minnesota. And I'd like to first thank Brittany and Lisa for their testaments today. Our goal is to make sure nurses and other healthcare workers are included and prioritized with the money that has been allocated. While very grateful for essential workers in other industries, healthcare workers have been impacted at a disproportionately higher rate in terms of workload disruption and contact and caring for COVID positive patients. We in healthcare continue to face these same impacts almost 18 months later, while many other occupations have returned to normalcy. Whether it be contributing to efforts of prevention with continued vaccination efforts, or care of the ill, performing COVID testing, answering phone calls from people with questions and anxiety about their symptoms and illness, providing education to clear up misconceptions and prevent further spread of infection, infusing monoclonal antibody therapy to prevent further hospitalizations, and ultimately providing acute care to those that do have severe illness. Our healthcare workers continue to be there day in and day out for Minnesotans. This is not easy, and it comes with high risk of burnout and compassion fatigue. We need to encourage healthcare workers like myself to be resilient and hang in there just a little bit longer. This money will help to recognize the sustained efforts of nurses and other healthcare workers and lift their spirits as they continue to care for the people of Minnesota. Thank you.
Thank you, Ms. Granote. Next, we have Arlen Swanson, followed by Nathan Johnson, and then Amanda Kunoman. Mr. Swanson?
Yeah, thank you, Mr. Chair. My name is Arlen Swanson. I'm the administrator and CEO for Maple Lawn Senior Care, and also a newly trained bed maker for the facility. We are not a not-for-profit provider of nursing home and assisted living services here on our campus in Fulda in Southwest Minnesota. We're the only nursing home in Murray County. Our workforce of 100 employees cares for about 80 residents. Thank you for the opportunity to speak briefly on the importance of recognizing long-term care and assisted living staff members who've worked very diligently caring for Minnesota seniors during this extended pandemic. Imagine with me that you are Melissa, one of our nursing assistants with small children at home. Every day that you come to work, you must wear a mask and goggles for 8 hours or more. You're caring for 10 elderly residents and their most personal needs, like a visit to the bathroom, getting them dressed, making beds, assisting them with meals, and attempting to provide individualized care. On some occasions, you are even caring for someone who is COVID positive, so you are completely gowning and wearing a respirator mask. Plus, you are now doing this on a double shift or 10 days in a row because you are willing to pick up extra shifts, because you feel responsible. There are not enough workers to fill all the shifts. If you can imagine this, you will be able to understand some of what our caregivers have endured for 18 months and continue to endure today. And I can't probably say it any better than Brittany did, but they're picking up shifts they don't want to work, finding daycare that doesn't exist. They're writing employee schedules that are full of holes. They're attending continuous virtual update meetings by MDH, CDC, CMS, OSHA, and other agencies who are providing often conflicting guidance. They're calling families to explain once again the protocols for visitors, essential caregivers, outdoor visits, indoor visits, and then they have to hold the hands of residents who are unable to receive a visitor, or they're holding the hand of a resident who's at the end of their life. They're trying to do social distancing activities in a world where residents long for touch and comfort. In the past week, staff had to explain the options to a resident who wanted to go off campus to have what could be her final photo with the family members. But upon return to the nursing home, there might be extra testing and a possible quarantine. She chose to skip the photo, but it was a heartbreaking decision for the resident and for the staff who worked with the family. This used to be a simple decision. Another difficult decision we make constantly: when is our staffing adequate to admit new residents? Because of continued staffing crisis, these also have been painful decisions. It's not easy to turn away someone who needs care in our community because we don't have the staff resources to meet their needs. Our staff are heroes, plain and simple. They have met the challenge and are physically and emotionally worn out. It's sad now for me to hear a staff member begin to wonder out loud if they have made a poor career choice. They all need extended paid vacations to recover, and sadly, that's not feasible because there's no one to replace them. We are so thankful now that Minnesota legislature has allocated funds to recognize the work of these critical workers, those who have saved lives by standing in the gap, holding back the pandemic's worst ravages on our seniors. I do think that $1,500 would be a meaningful amount that would clearly communicate that Minnesota considers these staff to be heroes. I'm so proud of our team and how they've ridden the waves of this COVID sea. Yes, some members of the crew have washed overboard, but most have stayed to man the sails. I'm convinced that a significant and tangible gift would be a very welcome thank you for all they have done. It would be serve as a lighthouse, I guess, if you will, to the tired and the worn. I would also suggest a direct check from Minnesota that would be most meaningful, a nice way to express thanks. This method would help the gift stand out as being from the gracious and thankful people of Minnesota. And thank you for listening.
Thank you, Mr. Swanson. Nathan Johnson, and then Amanda Moen.
Thank you, Mr. Chair. Good afternoon, and thank you for this opportunity. My name is Nathan Johnson. I've been a nursing home administrator for 20 years. I'm the CEO of Pioneer Care in Fergus Falls. People will often ask me, how has it been to work in our nursing home or assisted living in the midst of a pandemic? I often share that since March of 2020, we have endured more than we ever could have imagined. We pivot with evolving standards for infection control, PPE supply chain challenges, visit restrictions, testing requirements, and outbreak management. We combat the effects of social isolation. We were among the first to accept the new vaccine. We continually answer to those who challenge these ways, and we continue to fight this battle day in and day out, 18 months later, with no apparent end in sight. Suffice it to say, this has taken a toll on our workforce. We have seen early retirements. Others have said this just isn't for me anymore, but many have stayed and with great resiliency continued to pledge safe care to our seniors. To illustrate just how close we are to the tipping point, I'd like to share some statistics with you. In our organization, it seems the most important metric has become our shift vacancy rate. Imagine that. This is the number of open shifts to fill at the beginning of a schedule cycle before travel staff and before pickups. Before the pandemic, our shift vacancy rates were in the range of 10 to 15%. By January of this year, we were over 20%. Last month was 30%, and this month is 34%. And we anticipate it may get worse. That's 65 people that our organization needs to hire just to get back to pre-pandemic conditions. So because of this, we've had to limit admissions in some of our settings, and we feel if we lose even a small fraction of our existing workforce, we may need to suspend admissions in all settings, even close units, and potentially transfer residents. This is terrifying on so many levels, and we cannot let that happen. All of this, ironically, while our admission rates are soaring back to pre-admission levels. Based on current demand, we should be adding beds back into our system and not taking them away. So access to long-term care services is severely at risk in many parts of our state. I share this because I think you've been given a tremendous gift of that which you can use to honor those who are with us on the front lines in our nursing homes, assisted livings, and other healthcare settings. You've got an incredible opportunity to send a strong message that efforts have been nothing short of heroic, that you've got their back, and that without them, our healthcare system would simply crumble. So it's my appeal to you today and my sincere hope that at the end of your deliberations, you would make hero pay worthwhile, meaningful, and impactful to all who labor in long-term care. A popular amount being discussed is $1,500. This amount gets us close to 2 weeks' pay for a direct caregiver. I would agree that this amount is meaningful and worthwhile. When this is all said and done, let's just make sure that our long-term care workforce feels appreciated by the hero pay bonus. Let's make an appeal for retention in our field. And let's allow this to pave the way for future discussions about building back a strong and sustainable healthcare workforce in our state. Our seniors and this life-sustaining work is depending on it. Thank you.
Thank you. And I see Sarah Holmgren has joined. I don't know if you're able to present yourself, you can do that now. Okay, please state your name and provide your testimony.
Hi, my name is Sarah Holmgren, and I am a nurse manager at Wellia Health in Mora, Minnesota. I want to thank you for the opportunity today to share my experience and my experience as a frontline worker. I come to you today to represent rural health in Minnesota, as well as nursing and emergency medicine. I would like to share with you my experience over the past 18 months through the eyes of myself and my peers. I have been an emergency department nurse, a critical care nurse, and a paramedic for almost 30 years. During that time, I have participated in mass casualty events such as a 35W bridge collapse, Ebola preparation, H1N1 preparation, not to mention the numerous tasks that emergency, medical, and critical care nurses are faced with every day. I have never seen fear in the eyes of my peers until the COVID-19 pandemic. I have never seen my peers feel as much stress and devalue as they have felt the last 18 months. Nursing and healthcare in general is a calling. It's not something that we do as a job. We do it because it is part of us. It is who we are. In particular, in rural Minnesota, in rural health, we had no incentives. We had no bonus pay. We had no sign-on. We showed up because it was the right thing to do. That's what we do in rural health. We don't have a float pool. We don't have an IV team or a lift team. We are rural health nurses who rise to the challenge every day to take care of patients, from newborns to hospice and everything in between. It's a unique privilege in nursing to be part of rural health. I want to tell you a story about my friend Julie, who as an ED nurse contracted COVID during her line of work. When we talked about her being exposed to the virus, I asked her what happened. Was it the PPE? Was it the lack of resources? And she told the story of a man who she was escorting back to a room who began to collapse in front of her, and she grabbed him. And when she did that, her mask got knocked off her face. And 5 days later, Julie was sick. Not only was she sick, but her husband was sick, who was a school bus driver, which resulted in one of the largest outbreaks through our school in the beginning of the pandemic. They both recovered and they're doing well, but Julie has lost her heart for nursing, not because of her getting sick, not because her employer hasn't supported her, but more because of the way she feels society has not recognized the sacrifice that she and her family make every single day. I don't want to discredit the other frontline workers who have suffered also through this pandemic. I understand that grocery clerks, city workers, postal service workers all contributed to keeping our economy going and our citizens safe. But I do not think that any of them reached out and helped a man not fall to the floor the way that Julie did. So I thank you for including me in this conversation today. I do appreciate the opportunity. Thank you.
Thank you. And then we have Amanda Kunomoan.
Hello, can you guys hear me okay?
Yes.
My name is Amanda Kunomoan. I work as a certified medical assistant at Alina, and I'm also a PCA for my disabled brother who lives with me. I'm also a member of the SEIU Healthcare Minnesota. As a clinic worker during the pandemic, I did several different jobs, which consistently exposed me to COVID. Around April, we set up a tent outside the clinic to screen for possible COVID cases. At first, we only had surgical masks. Later, we got face shields, goggles, and finally plexiglass shields. Every day, I had to argue with people who would refuse to wear a mask. Every day at work, I had at least one case where I knew someone had COVID. COVID was especially scary to me because I do, as I said, provide PCA services to my brother, who is a vulnerable adult and has caudal aggression syndrome. My typical day Starts at 5 a.m. I do PCA work from 6 a.m. to 7 a.m., then go to Alina until about 4:30, which when I come home, I work for my brother again from about 5 to 11:30 p.m. I worked hard to take extra precautions for him every day. Every day after work, I would come into the house in the living room. I'd have to tell him to go into his room. From there on, I would strip my clothes, put them in a garbage bag, sanitize my hands, and then strip from head to toe, like I said, take a shower, then go do laundry. My living room, which kind of turned into a place where I would relax after work, basically turned into a place that just disgusts me at that point. As with many essential workers, COVID meant extra financial burdens. Things like laundry, transportation skyrocketed in cost. There was also the stress of having to stay safe while at work, seeing so many patients. Due to the short staffing, I would see over 70 patients a day when I was used to seeing about 30. Our employer would send us long emails trying to explain safety procedures when they changed daily, but they changed so often I couldn't even keep up, and that just added to stress. By the end of September, I had a complete and total mental breakdown. I took about 2 weeks off of work. I had no vacation, no PTO, no sick time, and FMLA was running out. Nothing left. I was terrified of being let go. Like so many workers, I never got a COVID bonus pay. So I beg of you to give us this pay as essential workers we deserve, which is extremely overdue. We have sacrificed our bodies and mental health and put our families at risk to take care of others. Now it's time for someone to take care of us. Thank you.
Thank you for your testimony, and to all the testifiers for coming forward. That concludes the public testimony and the agenda. I do see Representative Frazier has his hand up, and we'll recognize him, and then we'll go to kind of final comments and next steps. Representative Frazier.
Thank you, Mr. Chair, and I'd like to echo to the testifiers. Thank you all for your testimonies. One of the things I want to just say on behalf of the committee members here is that we've heard testimony from so many workers over the several weeks that we've met here. And it is important and it's incumbent upon us to listen, take to heart, go back and watch the videos, read the testimonies that were submitted in writing. But those workers that were there day in and day out gave us the testimony that we needed to know exactly what we need to do and what we must try to do. And that is to be as broad as possible. Many of those testifiers, many of our low-wage workers that were low-wage workers prior to the pandemic, which this pandemic exposed many of our disparities and inequities, those workers had such an uneven impact. Not every worker was impacted the same. All of our workers, all of our frontline workers have been impacted, but it was uneven for many of our low-wage workers, and then particularly in our BIPOC communities that saw an uneven impact in terms of how this pandemic took lives away. I mean, studies are showing us now that the lifespans have been lessened because of this pandemic. And that is what our workers were faced with. A large swath of our workers were faced with that. And we cannot forget that as we're making our delineations and our decisions here on how many workers we're going to include in this circle to ensure that they all receive recognition for the work that they did, that we asked them to do, that we kind of required them to do. That's the thing. We asked them to step up, and they did step up. And I just want to make sure that we center that. So again, thank you testifiers today for all of your testimony and for all the workers that testified over the several weeks that we had here. Thank you all very much for taking the time out of your day, because I know it wasn't easy, because you're still working for us. Thank you for taking the time out of your day, for sharing your stories and confirming much of what we knew, but putting it on the record so that we can make sure we take that into consideration as we make a decision here. Thank you, Mr. Chair.
Senator Housley.
Thank you, Mr. Chair. And I too want to thank all the testifiers today. It has been a long haul for those that have been working in our long-term care and our healthcare facilities. And I'm so sorry to hear your story, Sarah, about your fellow nurse, Julie. and that she feels that way. But I'm hearing that also, that this hero pay would mean a lot to these workers, that they are appreciated. And to our long-term caregivers, I know we are losing so many of them for the exact same reason. And I don't know, none of us know what it's like to have to go to work every single day in PPE and masks and goggles and face shields every single day for 18 months. That's what these people have been facing. So I want to thank all of these testifiers. And Amanda, for you, PCAs, I definitely believe that they should be included in this hero pay. So, Mr. Chair, I just want to thank all the testifiers for coming today. And I don't know if you want to go to where we go next, if you want to take that or start with that, or if you want me just to tell you where I think we should go.
Senator Housley, you have the floor.
Thank you, Mr. Chair. I think we all could use a holiday weekend. I think that would be nice if we could mull this all over, especially the two different proposals, and actually, as committee members, think about where we do have consensus on all of those items that we said further. And then Chair Winkler, we can talk right after Labor Day and maybe pull together something that we could present to the committee. I don't know if that's amenable to you.
Well, Senator Housley, I'm a little bit conscious of a deadline that the legislature gave. It said $250 million, and it also said September 6th. And so I would hope that we could at least make some effort to make further headway before Monday. I know that Labor Day weekend is a time for a lot of things, travel and so forth, but it is Labor Day and we are discussing workers. So I don't mind putting in a little bit more work to see if we can get a little bit closer before Monday and honor not only, of course, as we've discussed, the $250 million, but a deadline and see how close we can get. I don't think we need to, I don't think we can commit to working full time all through the weekend. I'm not suggesting that, but I do think a little bit of work to try to see where we can get would be in order. And it feels to me like, well, I don't want to be too, it feels like we can put in a little bit of time, and I hope that we can do that.
Absolutely. I'm not even going on vacation.
Any other comments from committee members or group members? Okay, thank you for your time and to the testifiers today. And we will have a public announcement on a next hearing. And if all goes well, we'll have something to share very soon. Thank you.
Thank you.
We're adjourned.